Why is attenuation important in a kidney court scan report? Imagine trying to understand how healthy your kidneys are just by looking at pictures. That's where attenuation comes into play. Attenuation is a key measurement in kidney court scans that tells us how much X-ray radiation is absorbed by the kidney tissue. This absorption is measured in Hounsfield units, a standard scale where water is 0 and dense materials like bone are around 1,000. By measuring how much the tissue absorbs X-rays, radiologists can gather important clues about kidney health and possible disease. Attenuation values help doctors see if the kidneys are functioning properly. When comparing the two kidneys, a difference of 5 Hounsfield units or more can be a strong sign of a problem. For example, if one kidney shows lower attenuation, it might mean there is an obstruction like a kidney stone blocking urine flow. This difference is very specific and reliable for detecting obstructive stones that cause kidney swelling or pain. Lower attenuation in the affected kidney indicates reduced blood flow and less function, often caused by the blockage. Beyond stones, attenuation measurements can also reveal issues like narrowing of the blood vessels supplying the kidneys, known as renal artery stenosis. By measuring the density of urine in each kidney during a delayed scan, doctors can detect significant blood flow problems without needing invasive tests. This non-invasive approach helps identify which kidney is not getting enough blood, guiding further treatment. Attenuation is especially useful in identifying kidney tumors. Simple cysts, which are benign, usually have low and uniform attenuation values, often 20 Hounsfield units or less. But kidney cancers, called renal cell carcinomas, can sometimes look similar at first glance. The key difference is that cancers tend to be heterogeneous, meaning their density varies throughout the mass. When radiologists measure small areas within a suspicious mass, they often find higher maximum attenuation values above 20 Hounsfield units, usually between 26 and 32. This variation helps distinguish cancer from benign cysts. Advanced techniques like texture analysis look at the pattern of attenuation within a mass. They measure how irregular or complex the pixel values are, a concept called entropy. These methods can improve accuracy in telling apart benign cysts from malignant tumors, often matching or surpassing expert radiologist evaluations. Combining these measurements gives a clearer picture of whether a kidney lesion is benign or potentially cancerous. Attenuation also plays a role in assessing kidney function over time. By measuring how the kidney tissue absorbs contrast dye hours after injection, doctors can detect early signs of kidney impairment. This helps identify patients at higher risk for progressing kidney disease, even if they do not show obvious symptoms. Such functional information is crucial for planning treatment and monitoring. In everyday clinical practice, attenuation values give radiologists objective data to support their visual assessments. Instead of relying solely on what they see, they use specific thresholds and patterns to make more accurate diagnoses. This is especially important when screening for kidney cancer or evaluating incidental findings. Proper interpretation of attenuation helps avoid unnecessary procedures and ensures patients receive appropriate care. Overall, the importance of attenuation in kidney court reports lies in its ability to provide measurable, reproducible information. It enhances the detection of kidney disease and cancer, helps assess how well the kidneys are working, and guides treatment decisions. By turning complex images into clear, quantifiable data, attenuation makes kidney imaging more precise and reliable. Always remember, if you have concerns about your kidney health, consult a healthcare professional for personalized advice and diagnosis.